I don't recommend any particular limit to the amount of screen time after LASIK at all. Most patients will have some degree of dryness after their LASIK, which manifests as foggy, fluctuating vision over the first month or more. There's no harm done by using a screen, and let's face it, everyone uses screens a lot of the day. Many patients will experience more eye fatigue and fluctuating vision after long periods on screens, but it won't damage anything or impair your LASIK recovery. I recommend keeping a bottle of artificial tears nearby so that you can use them frequently if you feel tired. Your eyes will dry out a little more quickly after LASIK, so hydrate well. Some folks think that fish oil may be a benefit to help the recovery of the surface of your eyes after LASIK. Some people recommend the 20-20-20 rule, which says that after every 20 minutes, look at something 20 feet away for at least 20 seconds to rest your eyes. I think that's a reasonable idea, but there's no evidence of any harm if you don't do that. Now, using your phone, you could use it 4 to 6 hours after LASIK. In the first 4 to 6 hours, your eyes will burn and water, and it's best to sleep or relax. Remember to hydrate well and to keep your eyes closed using a cool compress or freezer gel pack if it feels good. A good tip a patient told me is that they keep the gel packs in the refrigerator rather than the freezer so that they weren't rock hard. After that initial 4 to 6 hours, you can use your phone as much as you want if you're comfortable doing it. As far as using your computer, the same recommendations apply. I think it's reasonable to take it easy the first 24 hours or so just to get through the initial recovery. You really can go that long without using your computer or phone. As far as driving, the limitations may be a little different. If you're not seeing clearly, you're not driving safely. So wait till you're seeing fairly clearly. Now, that said, the vast majority of our patients, probably greater than 90%, would pass a driver's test easily on day one post-operatively. The requirements for passing a driver's test are 20/40 vision, that's with or without any glasses or contacts. Now, after your LASIK surgery, you will no longer need that correction, but in the first 24 hours, your vision will likely be foggy or blurry to some degree. As far as exercise, I always tell my patients you can do whatever you feel comfortable doing, but don't get hit in the eye. Always good advice. That is, you can go snowboarding, head a soccer ball, stand on your head for yoga inversions, but don't let your toddler or anything else poke you in the eye. The LASIK flap is not easily moved. The LASIK flap will not move from squeezing, blinking, or using your eyes. There are case reports of people having eye injuries years after their LASIK and the flap moves, but my feeling is that this is extremely small risk in the first place, and any eye trauma can create injuries regardless of whether or not you've had LASIK surgery. All injuries are unique and can be serious. They must be seen immediately by an ophthalmologist or optometrist as soon as possible after the injury. The LASIK flap, in my experience, can potentially be repositioned safely and have no further issues, although this may not always be the case. As we mentioned earlier, you can do whatever you want, whenever you want. Just get the eye drops in as directed and don't get poked in the eye. Everything else will be fine. Your eyes may be drier if you use them a lot, but you can use artificial tears to soothe and comfort your eyes as well as improve your vision. As far as exercise goes, you can exercise as much as you want. If you're engaged in heavy exercise and have sweat in your eyes, it may burn because it's salty, but it won't do any damage. I would drink a lot of water and use artificial tears to dilute the salt if it gets in your eye and if your eyes burn. Now, swimming is the one activity that I would recommend waiting a minimum of a week to engage in. One of the main benefits of LASIK surgery is exactly what we've been describing above. You can go back to regular activities 4 to 6 hours after your procedure. Live your life to the fullest with minimal downtime. Use the medicated drops as directed and you will be fine. How cool is that? So come see us at SharpeVision. Thank you.